The Ministry of Finance has issued financial clearance for the payment of outstanding salaries owed to medical doctors and some categories of nurses across the country. The move follows months of agitation and protest by health professionals, especially the nurses, over delays in salaries and employment formalities. The clearance paves the way for the Controller and Accountant General's Department to process and release funds, bringing relief to the staff within the Ghana Health Service and teaching hospitals.
A country to govern. Ladies and gentlemen, as I speak to you now, that about 6,500, that will add up to the 7,000 already being paid, making 13,500. That's allowance, that's over 6,000. Cabinet has approved that with immediate effect, starting from November, the Minister for Finance must pay them. And I have in my hand the letter to that effect. And so these were the difficulties. I empathize with anybody who had to go through this painful situation. And it is important for Ghanaians to be taken along.
Meanwhile, the Ghana Health Service has issued a formal query to a nurse, Bernice Abuaji, after she was allegedly captured in videos circulating in social media using what the Ghana Health Service describes as unprintable, inappropriate and scandalous, a language directed at the Minister of Health, Kwabena Minta Akando. Let's take a look at that video. We'll be right back.
Why do you keep disrespecting us? What was our crime? Was our crime the fact that we went to buy nursing training forms and not purchase that of university to practice political science or what? You just came here to speak grammar to us. Show action. Madam Journalist, can I ask a question? The Honorable Minister, can he come and tell us that he hasn't been paid since he assumed office for these past 10 months? Can he come out and tell us? Can even one single assembly member come out and tell us that he or she, an MC, do you know how much they are paying MCs? Do you know? And do you know how much loans our parents took to see us through NCC and the universities? Why are you people being so inconsiderate? What's the drama? Honorable what's going on? No drama came. What's my movie? You did not collaborate. You went near Jacoa. A very masterpiece. Just a big blow baby. Oh, the original how your aunties be. I say, that's why I'm up. What was a politician? Why you saw better? Who's that? Never down. What about time? Young child can't go here. Can't go here. Can't go here. The problem is one about Bra, me national service. But in the music, I'm at that. Me travel somewhere so paya. Sikana, and you are supposed to me 10 months. Music cancer, because everybody was saying, sir, you have a pamunasis. MMP before the crane, you are with the say. Namia Tiamoka, Munita for your Tiamoka, you have a pamomo. I'm not going to kind of share suit to Betina. I can't say, no, pray, I trust a woman too. Am I, Yasuju, you say, oh, you know, be a junior. Send out credit to the most some China walk on. And then to never catch it, I said, what about Toya? Number two, and I want to mention Anna Ghana for a kick. I don't know, I don't want Manco Fiat, Uncle Juma. I die. Every time.
Well, there you have it, the nurse there, but we understand that the Minister of Health, Kwabena Minta Akando, has claimed or has pled clemency for the nurse in a statement that he released shortly after the Ghana Health Service released that statement. Well, this morning, our colleague Fatal, who was at the press conference, captured some response from the nurses there.
Over the last few weeks, nurses have been mounting the various pavements to protest against what they describe as failure on the part of government and clearing their 10-month salary arrears. Today, the Minister of Health, Kobna Minta Akando, held a press conference just to address those kind of issues. And after the engagement, the minister spoke about so many things. He said that currently some 7,000 nurses are being paid. 3,000 of them are on the payroll, but they are yet to be paid, and 3,500 of them, of another batch of nurses, are yet to be, enrolled into the payroll. But one of the critical things for many of the nurses who are here today has to do with the assurance or the announcement by the minister that by November, all the arrears would be cleared. He said the arrears for, some 6,500 nurses would be cleared by the end of November. And after this announcement, many of the nurses unions or members of the nurses union who were here were very excited about that, but some of them are also a bit skeptical as to whether this would be cleared as promised by the minister. But let me engage one of the key when it comes to this particular conversation. I'm here with the convener of the Unpaid Nurses and Midwives Association, Stephen Techia. Thank you very much for joining us here on Joy News. You must be very excited now that the minister has announced that by November, your salary arrears, 10 months of them, would be cleared.
Thank you very much for the opportunity. So yes, I would say we are excited with the response from the ministry, because we brought a petition, and in response to the petition, the minister has assured us they have had a go-ahead from cabinet to start paying us in the coming month, that is in November. And with that, we say thank you to the minister and the ministry. We are really excited. But there is a clause. The minister did mention that with the payment of all our arrears, the plans are yet to be laid out and they will make it known to us. That's where we have an issue, but we are hoping that the plans that the ministry will bring in relation to the payment of the arrears will be something that will be in our favor. And aside that, we are very happy, and we say thank you to the ministry.
But why do you have an issue? Because the minister said it clear that, your arrears will be addressed.
Sure. So now that we don't know as to when it is going to be cleared, all the arrears, and we don't know the plans they have in terms of payment of the arrears, we are not certain. We are a bit skeptical about that. But when we get a clear timeline as to when the arrears will be cleared, then we will say confidently that we are fully happy.
We've heard you a number of times talking about the fact that you've gone through so many struggles because you've not been paid for 10 months. Tell me about that struggle.
Oh, the struggles are rare. Me, for instance, I moved from a different town to go and rent at a different town. I had to stop what I was doing before and start my life for 10 months without being paid. Every day you wake up, you go to work,